Let's just dive right into this explainer because today we're unpacking a massive hidden threat to women's health that honestly demands our immediate attention. We're talking about ovarian cancer. In the medical community, it's earned a pretty terrifying nickname, the silent killer, and we're going to figure out exactly why. Here's our roadmap for today. We'll cover the rising threat, what ovarian tumors actually are, why it's called the silent killer, 5 subtle early symptoms, and finally, how to protect yourself.
Section 1, the rising threat. So get this, over the last 20 years alone, the number of ovarian cancer cases has absolutely skyrocketed. It's literally more than doubled. The data shows this increase typically starts showing up in women in their 40s, and then it hits its absolute peak for women in their 50s and 60s. So this isn't just some static, rare issue. It's a rapidly growing one. And the stakes here? They are incredibly high. Roughly half of all patients diagnosed with ovarian cancer will pass away from it. 50%. It's notorious for this exceptionally high mortality rate. I know that's a sobering statistic, but it really hits the nail on the head as to why understanding this disease and knowing how to spot it early is just absolutely critical. Section 2. What are ovarian tumors? Before we go any further, we really need to clear up a common misconception. You see, ovaries are normally tiny, about the size of the tip of your thumb. Now, an ovarian tumor is just a blanket medical term for literally any swelling or enlargement in that area. It could be completely benign, intermediate, or malignant. But ovarian cancer, that specifically refers only to the dangerous malignant type of tumor. Knowing the difference stops unnecessary panic when you hear the word tumor, while keeping you absolutely vigilant about cancer. Section 3. The silent killer. Now, the real tragedy of this silent killer all comes down to timing. If you catch it early, meaning the cancer is localized entirely to the ovary, the 5-year survival rate is fantastic, well over 90%. Almost everyone survives. But here's the catch. Because there are practically zero noticeable symptoms early on, over half of all patients are diagnosed dangerously late, at stage 3 or higher, when it's already spread to the abdomen or beyond. It's perfectly quiet, right up until it isn't. Section 4. 5 subtle early symptoms. So we need to play detective. The first clue to look out for is abdominal bloating and pressure. This happens because as the tumor grows, the ovary physically swells and presses on the abdomen. It creates this stubborn feeling of fullness. You might even deal with indigestion or constipation, feeling completely stuffed even when you've barely eaten a thing. The second symptom? Frequent urination and discomfort. As the cancer expands, it starts pushing right up against the bladder, and that physical pressure causes constant, overwhelming urges to use the restroom. Sometimes it even brings a burning sensation. The really dangerous part is how easily we just brush this off as a regular old bladder infection or a UTI. Clue number 3 is persistent abdominal and pelvic pain. Now, we're not talking about a sharp, sudden cramp here. What you're looking for is a dull, continuous, heavy ache in the lower abdomen or pelvis that just doesn't go away with rest. It feels distinctly different from your normal cyclical menstrual cramps. If that pain is constant and steadily getting worse, it's a massive red flag. Fourth on our list is a sudden loss of appetite and getting full way too fast. Because that growing tumor is literally taking up physical space and crowding your digestive organs, your body's mechanics get totally thrown off. You might notice a dramatic drop in your appetite or find yourself full after just a couple of bites. Over time, that unexplained inability to eat normal portions can actually lead to noticeable weight loss. And our 5th early warning sign is irregular bleeding. This means bleeding completely outside of your normal cycle, or, crucially, bleeding that happens post-menopause. This pops up when cancer cells start affecting the surrounding tissues, like the endometrium. Sure, most irregular bleeding isn't cancer, but when we're trying to outsmart a silent killer, you absolutely cannot ignore it. When you look at the data, it's wild how common these easily dismissed annoyances actually are among diagnosed patients. A massive 50% experience that abdominal pain and bloating, 33% deal with frequent urination, and 24% actually report feeling a physical lump in their abdomen. So these aren't just rare anomalies, they are the standard warning signs. Even the slightly less common symptoms are still super prevalent. Loss of appetite hits about 23%, and irregular bleeding affects 19%, meaning roughly 1 in 5 patients experiences them. Every single one of these symptoms mimics a minor bug or a UTI, but when they persist, they become critical red flags that demand a doctor's attention. Section 5. How to protect yourself.
Because these symptoms are so incredibly subtle, please do not just assume you're fine or wave it off as just a stomachache. If these things persist and start messing with your daily life, you have got to proactively visit a gynecologist. And here is the absolute most important takeaway from this entire explainer. Explicitly request an ultrasound during your screenings. Because early-stage ovarian cancer is basically invisible from the outside, an ultrasound is essentially the only reliable way to look at the ovaries and catch this thing early, when it's still highly treatable.
As we wrap up, I want to leave you with one vital, potentially life-saving question to ask yourself or the women in your family. When was the last time you had an ultrasound? Seriously, don't wait for the silent killer to make noise. Be proactive, listen to your body, and explicitly ask for the tests you need. Knowledge is your absolute best defense. Thanks for joining me on this explainer, and stay healthy out there.